Hey everyone, in this video I will talk about a news story from 3 days ago, much talked about all over the news programs, newspapers, and internet news sites and blogs. And it was a rather disturbing figure, showing healthcare insurance premiums up 9% per year, much higher than the 3% rate of the year before. I will discuss the underlying cost drivers pushing up premium rates higher and specifically counteract the vulgar propaganda that blames Obamacare solely for the premium price increase. Now, if you stick around till the end of the video, I will explain why I am not a supporter of Obamacare. In fact, nothing I say here should be misconstrued as supporting Obamacare. Rather, I wish to show the blatantly propagandistic right-wing critique of the healthcare industry in this country, specifically by focusing the blame erroneously on just Obamacare. The right is misdirecting us from the true sources of the premium price increase, and that is significant if we are to move beyond Obamacare and any right or left-wing plan that maintains the primacy and prerogatives of the wasteful private insurance system and the anti-competitive and wasteful hospital and physician system we have in this country. Now, before I continue, a side note: I will grudgingly use the term Obamacare throughout this video. My hesitation comes from the belief that I shouldn't recognize plagiarists for the works that should be credited to others. Obamacare is basically a Republican brainchild, very similar to Romneycare in Massachusetts, and virtually identical to the broad outlines of a plan proposed in the mid-1990s by the Heritage Foundation. Yes, it was the Republican Heritage Foundation which first proposed the individual mandates. And yes, it is a Republican, Romney, who supported the supposed logic for individual mandates during a recent Republican presidential debate. To be honest, I think it should be called Heritage Foundation Care. Heritage Foundation, Ronald Reagan's favorite think tank, since they're the ones that thought it up. But I will stick to the propagandistic conventions of calling it Obamacare for the sake of communication and understanding. Now, before getting into the heart of my video, in which I'll rely on this study from PricewaterhouseCoopers, which came out a couple of months ago, I want to talk about I want to point out a couple of news reports that came out in 2009 and 2011 respectively. These reports talk about the decade-long trend in insurance premium costs. These two sources are CNN and ABC News, and they're citing the Kaiser Family Health Foundation, a very respected think tank. And the reason I want to point this out is because this shows that prima facie, the reason insurance costs are going up really can't be attributed to anything that's gone in the last couple of years, because it's something that has been going on for well over a decade. So from 1999 to 2009, the annual cost, I have it highlighted here, the annual cost of family coverage has risen 131%, and the annual cost for single coverage is up 120%, according to Kaiser. In each of the past 10 years, insurance increases have outpaced inflation, sometimes by as much as 11 percentage points. That's CNN.com. By the way, I will provide links to all the articles I use in this video below. And here's just recently, 2011, ABC News, quote, "The rate increase from 2001 to 2011 is faster than wage hikes and general inflation, which rose 2.1 and 3.2% respectively. The figure has risen a whopping 113% in the last 10 years, according to Kaiser." And in fact, this year's 9% premium increase was bested 4 times by the Bush administration. Bested as in it was worse. 4 out of 8 years during the Bush administration went up double figures. It's not to blame Bush, it's not to exculpate Obama, but it's to tell you that this is something that has been going on for many years, so we really should look at the underlying cost drivers that have been doing this for the past 10 years. And so let me begin by focusing on this 25-page PDF report that came out a couple of months ago from the neutral PricewaterhouseCoopers. So neutral, in fact, PricewaterhouseCoopers back in October 2009 came out with a report very critical of Obamacare. In this most recent report of earlier this year, they identify three main cost drivers for the rise of medical costs and premiums. And let me go through each of these three in turn. What they call, quote, the biggest inflators of the medical trend, which they say is provider costs. Number one is cost shifting for Medicare. As Medicare pays a lot less for procedures, for equipment, etc., hospitals are, quote, renegotiating terms and shifting more costs to commercial payers during their negotiations. So that's causing premiums to go up. That's number one. Secondly, provider consolidation is increasing. Physician mergers are at record levels, doubling from 2008 to 2009, and then increasing to a record level in 2010. Hospitals have also been consolidating, and what's happening is that these groupings have increased bargaining power, and that's driving up premiums. Finally, they point out another big one is hospital investment in IT, information technology, and staff in order to advance and to modernize their electronic health records systems. And this was stimulated by the 2009 law, not Obamacare, a different law that was passed in 2009. And stimulus money was also spent in order to spur this activity, but even with the stimulus, it's costing tens of billions of dollars, and that's leading to price increases as well. Needless to say, none of this was mentioned, not even by the New York Times, supposedly liberals, or even PBS when I saw their report. I think they might have mentioned one of those three. But certainly the knee-jerk conservative response was not to mention any of these three things either. They instead latched on to the impending doom thanks to Obamacare. Specifically, they talked about the new regulations which took effect this year, in which 18 to 26-year-olds can stay on their family insurance plan instead of being cut off at age 18. At best, this has increased premiums by 1 or 2%, according to Kaiser Health. I'll provide the link below. As PwC, PricewaterhouseCoopers, points out, let me see if I can point it out here. One moment. Yeah, the other regulation that's talked about is the lifting of the $1 million lifetime cap, the lifetime limit. And according to PwC, that has had a negligent effect. Let me go to this exact part of the report. Here it is. And I've highlighted it here. It probably won't come out very clearly, but it's page 10 of the PDF report. You can't miss it. However, removing lifetime limits, which many employers have already dropped, won't add much to cost trend. PwC's analysis in 2009 estimated that raising or removing lifetime limits would elevate monthly premiums by 1%. So it's not like Obamacare has had zero effect. 1% there, 1% with this law. That's it. The remaining 7 or 8% cost driver has to be explained, and that's where PwC focuses on provider costs. And that's where these news articles should be focusing, and the knee-jerk right-wing reaction, but they're not. Now, let me go to this Forbes blog, very anti-Obama, again focuses on Obamacare when explaining this, not talking about these other three reasons. But they get into into three specifics. They mention regulations and tax increases. Those are the first two. But the funny thing is they mention these mandates, but when you go to the specifics, here are the specifics that they link up to. And voila, most of these regulations and mandates don't go into effect till 2012 or 2014. So they can't be the reason behind the cost increase. And the same thing with the taxes, especially the big one, the tax on employers, in order to fulfill the individual mandate part of Obamacare. But the third thing that he mentions here is that third, insurers know that Obamacare's insurance price control regulations, here I'll highlight it here, I'm reading it verbatim, are set to go into effect in 2012 and are doubtlessly trying to get in as big a price increase as they can before the process of premium increases becomes completely politicized. Full stop right there. Pricewaterhouse, once again, very neutral. They address this directly, this point directly, and then I'll go to a concrete example. 1 second. They point out that, yeah, sure, in anticipation of these increases, of these regulations, there might be increases, but they also point out that, quote, the opposite may be true. If market participants are concerned about the negative publicity from large price or premium increases, especially in an environment where the healthcare system is often politicized. So that's why they think that it could be a wash. They don't see any substantive effects, perhaps. Actually, I misquoted that there. They're using substantive there to talk about something else. But let me turn to a New York Times article. Let me put some more meat on this assertion that the opposite could be true. And let's turn to the LA Times article. Yeah, this is a very interesting article regarding Aetna, major insurer. And here's the first paragraph. Quote, it turns out, I'll highlight it, it turns out pigs do fly. Last month, Aetna received approval from Connecticut regulators of its request to reduce premiums on individual policies by an average of 10% starting in September. Yes, you read that right. Reduce the premium. In short, what's happening is this. When that Forbes article talks about price controls, what it's talking about is something known as the medical loss ratio, which is the amount of money, the amount of premium money that medical insurers have to spend on actual medical procedures, on pharmaceutical products, on drugs, etc., on actual medicine and healthcare, as opposed to things like what falls under the category of administrative costs, like brokers' fees and paying out multi-million-dollar bonuses to CEOs, or the lobbying activities of these insurance companies, etc. And so that's the countervailing downward pressure potentially that we could get from the quote-unquote politicization of the premium increase process that Forbes laments. They don't talk about this potential other side. And finally, let me make this other point. I read something very interesting here as I was reading the comments to the New York Times article. A commenter made the assertion that even Obama's own CMS, the Center for Medicaid and Medicare Services, their actuaries claim premiums will increase 88%. And so I Googled it. I Googled this, and let's see if I have the article that I Googled. Maybe I don't have it here. I don't think I can find it, so I'm just going to do it right now. Insurance, and I'm sorry for that delay, and here's the article. This is where the 88% figure seems to come from, and I'll highlight it. 88% increase, ominous, right? And no doubt this article made it on Drudge Report, and then it spread like wildfire all across the right-wing blogosphere. The problem is that a couple of days after this article came out, there was an update and a correction, and I doubt very many people who read it the first time came back to read the correction. And it's simply this. In the comments below, two commenters plausibly argue that I am eliding the difference between overall insurance costs and per capita insurance costs. What a huge mistake. So let me correct this 88% figure. The bottom line is that the 88% figure is misleading because of course overall insurance costs are going to go up 88% by 2014 because 20 to 25 million people will be purchasing insurance under the individual mandates. But when you break it up on a per capita basis, according to the CMS, then those 88% increases disappear. In fact, as another commentator pointed out, the the actuaries are projecting that medical costs will go up from 5.7 to 5.8% annually. Hardly any change. So in short, whenever negative news on the state of healthcare comes out, the right wing reflexively blames it on Obamacare, like automatons, instead of focusing on the issue with some depth and care. In reality, the premiums have been skyrocketing before Obamacare, and there are some elements of Obamacare which will mildly contribute to this increase, but also there are going to be other elements which will provide downward pressure on prices, like the case of Aetna and the medical loss ratio issue. Which brings me finally, and in conclusion, to why I truly despise Obamacare, which may surprise some of you who have stuck around to the end. Namely, it doesn't do enough to address all these crucial underlying issues I noted from the PwC report. Very fine report. They get into considerable detail. I recommend it. Furthermore, it's going to force tens of millions of people to buy insurance from private insurance companies who overpay CEOs, have overhead costs well above government programs like Medicare, and pay lobbyists to bribe Congress into undermining consumer protection laws. Imagine that. My premiums going to contribute to that. And that's why I focus on the right-wing critique the most, by the way. The assumption is that by increasing the number of people that are insured, by increasing government intervention, costs will go up. That is simply not true. Throughout the industrialized world, per capita spending on healthcare is less than here in the US, and they have more government healthcare in those very same countries. Furthermore, increasing the number of insured could very easily lower costs if the insured are 20 or the potentially insured are 20 or 30 somethings that are quite healthy but choose not to get coverage at this time. And there's a very interesting blog that I'll link to that talks about this phenomenon and how that's leading to an increase in Jan Sidorov's blog on adverse selection, how that's leading to an increase in costs right now. And that also came from a conservative blog, so it's always good to read what the opposition says because you can get some good information. But anyways, also preventive care could save a ton of money, but there's just no incentive for private insurance companies or a private insurance dominated system to fund preventive care, because why should any insurance company fund preventive care if people switch health insurance every few years, or if many of these benefits won't be achieved or accrued until people are in their 60s and 70s and they're on Medicare anyways, right? So there's just no incentive for preventive care. In short, this is a very complicated issue. I hope I have contributed to the discussion with this video, and thank you for watching.